We're just talking. Have you ever been to the fashion show they do at the high school?
I haven't.
Okay, so it's May 15. My daughter and I
Okay.
go, my daughter's 12, and we go every year.
Oh, I bet it's great.
It is
Yeah.
amazing. The creativity and the work these kids put into, they have a whole line. It has a theme. It is amazing. But Sushi usually helps
Yes,
coach,
correct. Yes.
some of them. And my daughter can't wait till she's old enough to be in the
In
class
the
and participate in it.
Key West Porch Talk, your home navigator. From the Keys to the Seas, it's all a thrill. With Ruth, your trusted realtor.
Hi, I'm Ruth, your Keys to the Seas realtor with LaFreno Real Estate at 1120 Duval Street in sunny Key West, Florida. This is Key West Porch Talk, and we discuss Key West life and the people that live, work, and play here. And today's conversation touches all of us, whether we realize it or not. When we talk about housing in Key West, we're not just talking about real estate. We're talking about stability, workforce, health, and the future of Key West. Today, I have Leah Stockton with me. She is the Director of Development and Engagement at Keys Housing and Health. Leah, welcome. And
Hi.
I'm looking forward to hearing about your organization, the changes that have come
Mhm.
through this past year or so, and also about you.
Yes.
So, why don't we start out with a little bit about you?
Okay. I'm Leah Stockton. I have been here in the Keys for 21 years, and my family came back and forth before then. So the Keys have pretty much almost always been home or some version of home for me. And I have worked in the nonprofit world for more than 15 years. And so this is what I do. I love it. I love this community. I love the people of our community, good, bad, ugly, all the things in between. You love the Keys, you love the Keys. And so I am glad to be here and chatting with you about, I love what you said, the people that live, work, and play here,
Yeah.
because that's all of us, right? We
Yes.
all do all of those things
Yes.
here. And so, yeah, I'm glad to be here. Thank you for inviting me to come chat.
Well, I'm excited because I know that the organization has gone through some restructuring,
Hmm.
and I'm excited to hear about that.
Okay.
So, you mentioned how much you love this job, the role that you do, the keys. So, what drew you into this particular work, and how do you continue to stay connected?
Like I said, this is my community and I want to be able to give back. My family, I come from a long line. I have two sisters that are in education. My mother was in healthcare. My dad has served on many nonprofit boards here in the community. And so it's sort of in my blood, right, to give
Sure is.
back. It really is. And this is really interesting. Eh, there are a few things in life as important as your health and where you live, right? And so
Absolutely.
this really gets to the root of stability and the ability for people to succeed in life is through these two things. And so to me, that motivates me to be able to continue to do this work.
So, for a person who has never heard about this organization, Keys Health and Housing, how would you describe exactly what you do?
Well, I would say that most people have probably never heard of Keys Health and Housing because the name is brand new. So we just rolled this name out. It's our 40th anniversary of the organization helping here in the community. And with that, we rolled out a whole new name, Keys Health and Housing. We have been known as, in the very beginning, as AIDS Help. Many people still call us AIDS Help. And then the name became AH of Monroe, and now Keys Health and Housing really encompasses our roots and where we started, but also our future, what we're doing now, and where we're growing. And so we have a tagline: health and housing, it's what we do. So if you ask me, people, like, you need your little quick elevator
Oh,
speech,
yes,
that's
yes.
what I say: health and housing, it's what we do.
Health and housing is important.
It
Yeah,
absolutely,
absolutely.
absolutely, and you can't have one without the other.
So I'm glad you touched on the little bit of the history because I was going to mention that because I know that it had you'd been around as AH.
a long
Monroe,
time.
that's what I knew you as because I
Mhm.
wasn't here before that. And you've evolved from supporting individuals with HIV and AIDS into the housing aspect.
Mhm.
So, why and how did that come about?
So the organization, a lot of people don't realize the organization has always had a housing
See,
component.
yeah,
Way back, the original Marty's Place over off of Bertha, and way back, we have had Harvey House and Seawall Place, and many housing, McCarthy Rogers, for decades, right? And the organization has always had that sort of balance between health and housing, and we still very much serve people living with HIV. We have about 250 clients living with HIV that we still serve each and every day. Many of them live in our housing, many of them do not. And then in addition, our housing is open to anyone in the community that qualifies to live there. And 2 years ago, the Florida Keys Outreach Coalition came under the umbrella of AH Monroe.
okay,
And so, with that, it even further expanded our services. And so now we have everything from emergency shelter, like you're homeless out on the
yes.
street coming into emergency shelter, all the way to affordable housing with the lofts at Bahama Village and sort of everything in between. And so it really, I won't say that the organization has shifted because we haven't. We've just sort of grown to meet the need of the
You've
community.
evolved over
We've
time.
evolved, right?
Yes,
And we've evolved because we've needed to. And a lot of
yes,
our folks that are living with HIV, they're living longer, right? It
yes,
used to,
absolutely.
and that's like a beautiful problem to have, that people are living longer. And so we've needed to evolve our services on the health side. We are actually now moving into needing to have geriatric care
Oh,
for some of our folks living with
yes.
HIV, as well as some of the folks that are in our housing and in our shelters as well.
So when it comes to the housing, it originally started with people with HIV and AIDS needing a place to
Hmm.
live while they were transitioning,
Yep,
because we didn't have the long
correct.
life expansion then. So how did you? I mean, I know we have affordable needs here. Is that how you kind of decided to expand as an organization beyond just the health aspect of it?
Mhm. So Scott tells the story, Scott Pridgeon. If you don't
Uh-huh.
know him, he's a wonderful person. He's a visionary. He's led the organization for many years. And he tells about when they built Poinciana Royale right here across the street of on Duck Ave, and that it was originally built just for people living with HIV,
Mm-hmm.
AIDS,
Yes.
and they couldn't fill the building
Wow.
because people didn't want to live in the place designated as that's where the people with HIV
Right, we had
live.
so many misconceptions back then.
Misconceptions, right? And so they opened it up to the broader community, filled the building right up, and it worked. It was
Great.
a supportive community. People of all walks of life live there, and ever since then, our housing has been open to anybody who needs it, and it really continues to be a successful um,
I,
scenario for
yeah,
us.
it's great.
Hmm.
I love hearing about the background because I haven't been here as long as yourself and many
Hmm.
others, and it's just a wonderful. Um, I just love the background of the history of the community and what organizations like yours are doing. It's fabulous. And I
Thank you.
wanted to touch base a little bit, sorry, just on your logo, because I think the logo says it all. It's a legacy of care and a future of hope.
That's right. That's what we want to do, right? And we
Yes,
continue to build on that legacy while we look to the future and what we can continue to do to serve the community.
I love it. So, since stable housing is a critical component when it comes to someone's overall health and well-being, I noticed that on your website it states that 97% of your clients are housed.
Hmm.
So, could you explain a little more about what that actually means in that statement?
Yep. Housing is healthcare.
Yes.
You can't be healthy if you don't have stable housing. It's a not to use really big fancy words, but it's a social determinant of health. Housing is, among many other things, that you can't have one without the
Yes.
other. If you look at the hierarchy of basic needs,
Yes.
housing,
Yep.
shelter is pretty much, the basis from which everything else builds from there.
Of course, that makes sense. Yes. So, what are the biggest housing challenges people are facing I know, we talked about the affordability, but I'm sure there's
Always.
other aspects of it as well.
Absolutely. Affordability always,
Yeah,
right, is the
yeah,
challenge. If you talk to conks that have been here their whole life or people have been here generations, affordability is always, you can't live in paradise without having that be part of it.
right.
But for us, another challenge that we see is sort of a bottleneck that folks come in through our shelter, through one of our programs, and then we need to create that path forward for them. And we reach a point, for example, we have an emergency shelter that men can come into over at the Nice Center. They can then stay 2 years in our phase 2 over at Point Siena. And at the end of the 2 years, they've gotten a job, they've gotten their credit back together, they've worked on their substance abuse, whatever it is that they have going on, and they're ready, right? They're ready to move to that next step out in the community into affordable housing, but they get stuck because there's nowhere to go because they
Right.
can't afford it. And so a big goal of us as an organization is continuing to build that permanent supportive housing so that our folks can continue, and the other nonprofits have the same challenge, so that all of our
Yes.
folks can continue to move forward. So I would say that is a challenge that we're sort of addressing as an
Yes.
organization right now.
Yes, because you have a number of properties that are under your umbrella that are affordable housing.
Yes.
How about let's talk about those, because you mentioned a couple of them, Point
Right.
Siena
Point
and
Siena Royale on Marty's Place and the Lofts at Bahama Village. And then, not to let the cat out of the bag, in the next 3 years, we will double the number of units that we have
oh,
of
that's
affordable
excellent. That's
housing.
great.
We're going to work with the school district for the lofts at Trumbo, which will be
Yes.
for school district employees. And then I think there's a little hierarchy. I think it's, don't quote me, city employees, then county employees, then, everybody else. I'm not exactly sure of the list just yet. But within the next couple of years, that project will get off the ground, and there are 150 units
Oh, that's
that
great.
they're building over there at
And we
Trumbo.
so need it with our workforce housing. I mean, with our workforce people needing housing, and a
Absolutely.
place to live.
And I mean, if we can't take care of our teachers, what are we even
Right.
doing, right?
Yeah, sure. Teachers, police, fire.
Everybody that makes the backbone. I always say that this is sort of the backbone of our community,
Yes.
right? Is the
That's the
folks that need
foundation.
this, the foundation of that's who needs affordable housing. If
Yeah.
you say who needs it, it's the backbone of our community.
Absolutely, because we wouldn't have a community without it.
Correct.
That's right. That's great. So I'm excited about those new properties, because I know the lofts, they were filled up like
Yes.
immediately.
They were filled up on, we do the rental side, 98 units there. And then they've also had great luck filling the homeownership side. The city has
Yeah.
the homeownership side as well. So it's a fantastic addition to that area of town for
Yeah.
sure.
So when you were talking about the process throughout which somebody could come to your organization and then get the help they need, there must be levels of counseling, people who work with like building credit back.
Yep.
You must have a huge staff.
Life skills. Yeah, we have
Yeah.
there's about 30 of us between the housing and the health side.
Yeah.
And then, sort of the infrastructure that has to support an organization of that size. But we work with life skills. We have case management. We refer back and forth to other organizations. There's a whole coordinated care system that we
Yeah.
put into
A
place.
system, exactly, to get people where they need to go.
Absolutely.
So
And
they can-
everybody's path is different. And so we
Yes.
come up with an individual plan.
That's wonderful.
Mhm.
And then they can feel like they're part of the community, working and living here.
Absolutely. And empowered.
Yes.
That's the goal, is to have someone be empowered to say, okay, now I can go from here.
Yeah. And as we all know, somebody who is happy and feels like they're a contributing part of society is going to be healthier.
Absolutely. Absolutely.
Excellent. So, I know we talked a bit about the people that are affected the most, but who are affected that maybe we're not thinking about, that we are unexpected? It's like, wow, really?
We have a rapidly growing elderly population
Yes.
that are
yeah.
in need of stable housing. They just cannot afford it on fixed income, or they never bought and the rental price has priced them out. We actually have, it's I mean, nobody wants to, warts and all, I said, so I'm going to talk about it. But in our homeless shelters, we have a really significant portion that are elderly
Oh,
and
yeah.
and just need somewhere to go and
Right.
need somewhere to live out their life with dignity. And so that is a challenge that we are currently seeing across the board within the nonprofits, but as an organization in particular. And so we are looking at how we can continue to build housing that can afford people that life that they need.
Right, exactly. Especially because we are at the peak of our baby boomer
Yep.
generation now.
Yep.
So
When you
and
think
a-
about baby boomers run the spectrum from
Yes.
low income all the way
Yes.
to very wealthy and everything in between.
Absolutely, and a lot of times, as you know, we age, family members and friends aren't around.
Yep.
Supporting us. So I'm
Absolutely.
glad that your organization is there for them.
Thank you.
That's great. So what is your day-to-day work look like as the director of development and engagement? That's huge.
So this position was created for me to come on board, and so
Created for you.
yes. So I've sort of built it out. One day I'm coordinating our Pride float. The next I'm holding a fundraiser, and then the day after that I'm rolling out a new name and logo. So all the things all the time. But I love it. I love that not every day is the same. I love getting out in the community, meeting new people, and
Yes.
and talking. Obviously, you can see how I love talking, but I love talking about the work that we do and getting people involved in it as well.
Well, it's such important work, It really is, because it touches so many aspects of our community, and I love that. I just think it's a great organization.
Thank you.
How about maybe can you share a story or two that our listeners might find engaging? Of some of the help that you've done, or maybe an accomplishment you've had of your own with the organization?
Well, we had the best taste of Key West we've ever had under my leadership this year. So yay! That I can't take all the credit for that. Nadine's team over at We've Got the Keys really are the true heroes of Taste of Key West. So that's a personal accomplishment that we brought in support that we need to be able to continue to do the work that we do. So kudos to our entire team of everybody, our vendors, our supporters, our sponsors, everybody for that. But really a story, I got a chance to sit down with a client a few weeks ago and listen to her story. And this is a woman who's been in the community for many, many years. And during COVID, she ended up living in her car. And she lived in her car for 2 years. And then she met up with one of our case managers who got her into an affordable housing unit with someone else. And she lived there. And during that time, she got custody of her teenage granddaughter. So she was living in a little 1-bedroom, her and the granddaughter. Yes. And the price continued to go up. And she now had the expense of taking care of her granddaughter. And it became that they couldn't afford it. And so our case manager was still part of her life. So she moved her out of there and actually moved her into one of our units where she pays just 30% of her income for her rent.
Good.
And so she's currently living in there. And their long-term goal is that they are on the wait list for the Housing Authority.
Wonderful. Because
she can then put her name and the granddaughter that will be coming of age, her name for the Housing Authority, and they can move over there, and that'll be a long-term stability plan for her and for the granddaughter.
Yes.
But this woman is absolutely incredible. She is determined that her granddaughter is going to have a good life, and she is trying to set her up for success. She's a giver. She's given to everybody else and taking care of her family and everyone else. And so our case manager, she's encouraging her to take care of herself.
Yes.
And focus on your health and what you need as well. And she credits our case manager with saving her life.
Oh my goodness. That's a great story.
And that she would never, she was said, I've been at my lows and and everything in between. And this is my dream that I have a home, I have stability. And she credits that 100% to the case manager, who then says, it's not me, it's you. You're the one who worked so hard to get you where you are. And so I think that shows how we can work together with folks to get them where they want to be and help just put them on that path.
And that's the exact point you made earlier on about empowering people.
100%.
That's excellent. Yeah,
100%.
Because she was a giver. She wanted things done for people, but she had to empower herself too.
That's right.
Because she also deserves it.
Yep.
Yeah, that's a great story.
Yeah.
Excellent. Great. And I know that that's changed her life and her granddaughter's
That's
life
right.
for sure.
100%.
So that's wonderful. So what do you think is the most, what prevents people from reaching out to access support? I'm sure there's some stigmas out there and stuff like that.
I do think, pride, I think probably comes in the way. Immigration status, unfortunately, that does come up sometimes. And, like I said, I've been in the nonprofit world a long time, and a lot of people won't reach out because they think someone else needs it more than me.
Oh, yes.
Or I'm not needing help. I'm the one that gives help. And so this comes up a lot after a hurricane.
Oh, yeah. Okay.
That people that have never needed help ever in their life suddenly find themselves in a situation where they need it. And so what I always tell people when that comes up is it's like a circle, right? Sometimes you're the giver, sometimes you're the one needing a little bit of help. So that's what we're here for. That's why this community is so great and generous to each other. So if you need it, take it. And then when you're back on your feet, you'll give again, right?
Yeah. It's a cycle. It's like
a
cycle of life.
Absolutely.
Giving and taking.
Absolutely. And I think that's what this community shows again and again. So, I think that if somebody is listening that is in need of help, please reach out.
Reach out.
We are here to help.
Speaking of reaching out, so how do they reach out? How do you have a phone number, an email? If you could share that.
Yep. For the housing, it's housing@keyshh.org, or our website, our new website, keyshh.org, or they can give us a call. Pretty much anybody in town that you ask within the social services world, we know how to get a hold of each other. So if they're already working with another agency, they can refer over to us as well.
So what's the main number that they would call?
305-296-6196.
Okay, 6196.
Yep.
That's an easy number to remember. That's great.
Yep.
So let's see. So I wanted to go back also about the empowering people and the giving and taking, because this is the most giving and taking community I've ever seen, I've ever lived in. And I mean taking in a very positive way, because it is good for us to be able to accept help when we need it.
Absolutely.
I think that's really important. So what are you building toward next? I mean, what's your 5-year goal now that you've made the organization has made these changes, you have a new direction? Well, I shouldn't say a more evolved, wider, broader direction. Do you have now a 5-year plan with this?
Absolutely. Like I said, we plan to double our number of units of affordable housing with the lofts at Trumbo coming online. And this summer, we are doing a soft opening of a home health-based geriatric clinic.
Oh, wonderful.
And we'll start with we have run a program for folks with diagnosed mental health conditions that are formerly homeless. So we'll start with them. Then we'll expand it through our folks living with HIV, our other folks living within our housing program. See how it goes.
I did.
See how it goes. Baby steps.
Yep.
But we're really excited. We've hired a physician's assistant to come on board to help run it. It'll be right there at our office at 1434 Kennedy. And that really, to that piece I talked about the geriatric needing, aging in place. And how can we help someone age in place and be healthy until they reach the point that perhaps they can't anymore, right?
And then they need additional
services. And we'll create that bridge to help someone. Okay, what are your next steps from there? So that's really exciting on the health side.
It really is. You're kind of an encompass all of it. Kind of organization, which is really important. I remember back when we used to have mental health covered under other services, and then that's been cut out for all these years. And I think when people become homeless, some of it may be a symptom of a mental health illness.
It often can. The number of challenges, a hurricane can make you homeless. Your landlord selling the house and you can't find anywhere else.
Shortage of housing.
COVID. I mean, during the pandemic, people lost their jobs. I mean, the reasons are varied, right? But then we go back to that giving community, and that if somebody does find themselves there, that our community steps up again and again.
Yeah, excellent, great. So, When someone says to you or thinks, this doesn't affect me, this meaning the whole aspect of homelessness,
Mhm.
aging, situations like that, what do you say to them?
I really think this affects all of us,
Yeah.
right? I mean, our workforce depends, like I said earlier, about the backbone of the community. They depend on this affordable housing. If people are not healthy and stably housed, they cannot function in a way within society that we need to be able to keep going as a community. And for the future, we talk about the future of the community, that we have to be able to put the effort and set aside our some of our limited housing. We're only 2 by 4 miles long,
Right.
so we
Yep.
have to be able to dedicate some of that to affordable housing so that we can continue to have the people working in the restaurants, and the people that take care of your yard, and the people teaching your children and drawing your blood at the hospital, and all of these things that are very much needed. Our lofts at Bahama Village, we have school district employees, we have city employees, we have people that work in grocery stores. We have people that work in other nonprofits. I mean, you name it. And we've probably got somebody living down there at the
Oh, I can
lofts
believe
that's
that.
in
Yes.
almost every industry. So I think that, and also, as a society, if people are not healthy, they're going to be using emergency services more, other social services. That's going to come at a cost. We all
Hmm.
pay the price of that, right? And to your point earlier about like the stability of our community and the success of our community. You can't be an engaged part of the community if you're worried about like where am I going to stay tonight.
Yeah, so it's really, for me, I feel like it's really important for people that are listening to get involved.
Hmm.
Are there ways to volunteer?
Absolutely. We have ways to volunteer. We always need volunteers for events.
Hmm.
We have a food pantry. I don't even think I've mentioned the food
Oh,
pantry.
no.
No,
Yes,
sorry.
no,
Also, we do
that's
that.
okay. That's
Also, we do
great.
that.
We have food.
The Loaves and Fish food pantry is at 2221 Patterson at the Nice Center. It's a non-perishable food, and so we are always looking for donations over there, and volunteers to help sort and run that as well. And like I said, we do life skills programs as well. So if you are out there and whatever your profession is or your background, that you think you would be able to help our clients develop these life skills, reach out for that
Oh,
as well, because
that's
that's
excellent.
another way to give back. Of course, philanthropic support is always
Yes.
appreciated. It's been a rough year for nonprofits across the board.
Yeah.
So, financial support is what makes us be able to keep doing. And, something else that I always tell people, advocacy is also really important. Even this sort of opportunity to come on here and be able to like raise awareness,
Yeah.
but also who you vote for.
Oh,
Who
yes.
you vote for. Are they supporting our working folks? Are they supporting affordable housing? Are their policies conducive to our ability to do what we need to do? That's a very simple way that all of us can help make a
That's
difference.
an excellent point because we do have local elections coming up in
We
August.
do.
And I believe that, having a stable, healthy workforce is very important to the community, as we've discussed.
Absolutely, absolutely. And yeah, so that's just another way, local, state, federal, that you can continue to just pay attention to who you vote for.
That's right. That's another way to be involved.
That's right.
Yep, from a
Yep.
distance, if that's what it takes.
Right.
Do you have anything else to add? Because we have a round called Truth or Tale after this.
I don't think so. Every time I speak publicly, I always try and end with saying that we're here to help.
Yeah.
If even if it's not you, if you know a friend, neighbor, colleague, someone that works for you that's in need of any sort of assistance, they can reach out. And if it's not us, then our case management team can connect them to who it
Right.
is that they need to, because the nonprofit community works really closely together here. It's another way that we're sort of that tight knit little community.
We are
Right.
absolutely.
Yeah, whether you like it or
Overlapped.
not, sometimes we're way overlapped. And so that's why I always close that if you know of somebody needing help to reach out. So
Yeah. So remember, it's Keys Health and Housing.
that's right.
Yeah.
That's right. All right, rapid fire.
All right.
How's
Here we
this go?
go.
You just
So,
ask it?
Yeah, I ask
Oh,
questions.
I hit a
and
button.
you get a button. Look at that.
Okay,
Yeah,
okay,
you
here we
You
go.
get a truth or a tale.
And then do
so
I tell you the tale
can.
or I
You-
just
you
push a
can.
button?
Nope,
Okay.
push it first. And then,
Okay,
yeah.
got it. Got it.
Okay, this is the fun part.
All right, I'm ready.
It's all fun, actually. I
Yes.
really appreciate
No,
all
of
of the
course.
insights you've given us. So, affordable housing is only for people who are unemployed.
100% false. My button. There we go.
Woohoo!
Now we're cooking with fire, right? Let's
And
go.
I think that was a no.
That was a no. I was gonna make that button work one way or another.
So if you work full-time in Key West, you should be able to afford to live here.
You should be, but often you can't.
That's true. And I'm in real estate. I know that.
That's right.
Yeah. Housing and health are separate issues. Well,
No,
we've elaborated
that's
on that
right.
one.
We know that one. Hopefully
Keys-
everybody listening.
Keys, health, and housing.
That's right. That's right.
Once someone has housing, the problem is solved.
No, but it sure does help.
It does. It does. We're really leaning towards
I
the
know. Give
tail.
me a green. Give me a green.
Affordable housing lowers surrounding property values.
No.
Oh my goodness. This is mainly a government issue fix.
No, public-private partnership.
That's right. Small communities don't face serious housing or health challenges.
Oh my goodness. I always tell everybody we have all the mainland challenges and then we bring our own whole little set here on the island community too. So
That's right. That's
absolutely
right.
not.
So anyway, here's the last question. This issue doesn't impact me if I already own a home.
No.
No.
I didn't get any
We didn't
green.
get any positive ones.
That's right. That's right. We hit the green one just to hear it.
I'll have to talk to whoever made these questions
That's
for
right.
me.
That's right.
Oh my goodness. Well, thank you today. It's been really a
Yes.
joy getting to know you more and hearing about the organization and its expansion. And as we remember that it's not just about housing, it's not just about health, it's about the foundation of our community.
Absolutely. I really appreciate you having me. Thank you for all that you do. Thank you for bringing a voice to this because you're right. It is for our community and we really appreciate the opportunity.
Well, thank you. I've learned a lot today, and I hope that our
Yay.
listeners have too. Again, it's Keys Health and Housing.
Yep.
And Leah Stockton, who's the Director of
Development
Development
and
and
Engagement.
Engagement. That's
right.
a lot.
It's a mouthful. That's right.
Thank you. This is Leah Ruth, Keys to the Seas Realtor. And Key West Porch Talk can be listened to on Spotify and YouTube. We drop new episodes on the 1st and the 15th of every month. And until next time, enjoy.